Hello there, this is Dr. Mowlavi coming to you from High Definition Academy. We're doing the 100-day challenge for liposuction questions. Today's question is liposuction associated with scarring? So what is a scar, you guys? A scar is when the incision line that is created surgically, like a cut that goes through the entire skin, once it heals, if it doesn't look pretty, it's called a scar. We do everything in our power to help that incision heal beautifully, so it's nearly transparent, but sometimes you can get a little scar. And scarring is a very complex topic. Scarring isn't just the doctor's fault. Sometimes scarring is genetic. Some people scar worse than others. Some people don't scar at all. In general, if you're light-skinned and light-hued in your toning of your skin, you're going to heal better than if you're darker or olive skin like I am. We typically tend to scar a little worse. Now, those are out of our control, right? Your genetics are out of our control. But there are things that are in our control, and there's a certain capacity for scarring and liposuction. So this is what I'm going to talk about today. When it comes to liposuction, there's two types of scarring that I would like to talk about. Number one is the conventional scar that we just explained, where there's an incision, right? And why do we need incision in liposuction? Because we have to stick those hollow bored rods called cannulas into underneath your skin to peel out the fat. So we need an insertion point, what we call is a port site to go in. Now, thankfully, for liposuction, these little incisions are about 4 to 5 millimeters. They're not very big. They're tiny little holes. And first of all, we strategically plan them so that they're in areas that are hidden. So for example, in the upper area, to do the abdomen, for example, we use port sites that are under your breast in your inframammary crease, so they're hidden in the shadows. From down below, we use little port sites in the pubic area, and sometimes one in the belly button. So they're strategically placed, number one. Number two, they're tiny. They're very tiny. Now, regardless of how tiny they are, when they heal, if they heal poorly, they're gonna be called scars, okay? And so one of the things that leads to that scarring, we've talked about your genetics, your skin color, but one of the things is technical, is surgical technique. Imagine if I stick a rod inside and outside through that little hole 1,000 times or 100 times, where I'm going to irritate the hell out of it. Mechanically, I'm going to traumatize the skin edge, even though it's tiny and short, and that's not going to heal well. Now, one of the things that we use in high definition liposuction protocols is a port protector, you guys. So that's one of the secrets. I always ask your surgeons whether they use a port protector. A port protector is a little plastic little shindig that has like a hole in it, and you sew that in all the little ports, and then when you're going back and forth with the liposuction cannula 100 times or however many times, it literally protects the skin from irritation. So that's one of the big secrets, you guys, when it comes to scarring and liposuction. If you use port protectors, you will have much nicer and more hidden incision line healing and potentially not scars. Okay? The second answer to the question is scarring has to do with scar tissue that forms inside. So it's not the conventional scarring that you're thinking of. It's in the subcutaneous tissues. It's the inflammation in the tissues that you've liposuction. For those out there that do liposuction revision, you know what I'm talking about. When you go back to redo a liposuction case, when you're trying to lipo, it's a lot tougher than the primary liposuction where they've never had any irritation of the tissues. You get scar tissue forming inside there. And if you're not careful and cautious, and if you're not cognizant, and you overdo your liposuction, you can get subcutaneous scarring. It's called hyperinflammatory fibrosis is the term that we use. And the hyperinflammatory fibrosis is basically hardening of the soft tissues. And you can sometimes feel it. Sometimes it's more aggressive, and often it's not. You can't even tell. The hyperinflammatory fibrosis, the good news I have for you, will get better with time. In severe cases, we do employ external radiofrequency to treat the hyperinflammatory fibrosis, and we're able to get it out within about a month or two. Let me explain. If you're going to get hyperinflammatory fibrosis, where it's hardening of the soft tissues, you're going to experience it within 2 to 4 weeks following liposuction, and it will typically last about 2 months. If you use the external radiofrequency devices, you can hone that in and you can tighten that schedule, and you can get back to soft tissues sooner. But there you have it, you guys. Is liposuction associated with scarring? It can be. One is conventional incision line scarring that you can minimize by using proper technique with not overdoing the irritation of the skin edges by using pore protectors. And two, you can get something called hyperinflammatory fibrosis that we can deal with and successfully, routinely get rid of for you, with time being the most effective tool, because all hyperinflammatory fibrosis will eventually subside. Thank you.